Understanding the standard, the foundation of professional practice. As we move into one of the most critical sections of this course, we shift from compliance and supervision into liability and legal exposure. The standard of care is not just a concept, it is the benchmark by which every agent and broker is judged in a complaint, audit, or lawsuit. At its core, the standard of care is defined as the level of skill, care, and diligence that a reasonably prudent real estate professional would exercise under similar circumstances. This concept connects directly to everything we've covered so far. Supervision ensures compliance, and compliance ensures that the standard of care is met. Why the standard of care matters: protection and risk management. There are two primary reasons why the standard of care is so important. First, it protects the public, which is the primary mission of the Arizona Department of Real Estate. Second, it serves as the foundation of risk management for brokers and agents. When agents meet the standard of care, they reduce the likelihood of complaints, lawsuits, and disciplinary action. When they fail, the consequences can include civil liability, license discipline under ARS, paragraph 32-2153, and reputational damage. Commissioner's Rules, AAC, R4-28-1101H. Arizona law clearly establishes that a licensee must provide services consistent with the standards of practice and competence recognized in the professional community. This means agents cannot operate outside their area of expertise without either disclosing their lack of competence in writing or engaging a qualified professional. This ties directly into supervision. Brokers must ensure their agents are not practicing beyond their skill level. Realtor IR. Code of Ethics. Article 11. Article 11 of the Realtor R Code of Ethics reinforces this concept by requiring Realtors R to provide competent service in their field and avoid practicing outside their expertise without proper disclosure or assistance. This creates a dual standard, legal and ethical. Even if an action is technically legal, it may still violate ethical standards and create liability. Fiduciary duties, the core of the standard of care, under AAC, R4-28-1101A, licensees owe fiduciary duties to their clients, including loyalty, obedience, disclosure, confidentiality, accounting, and reasonable care and diligence. These duties are not optional, they are the baseline expectation in every transaction. Failure to meet these duties is one of the most common causes of lawsuits in real estate. Competency and disclosure, a critical balance. Arizona law allows a licensee to disclose a lack of expertise and still perform services, but this creates a gray area. Many legal professionals argue that simply disclosing incompetence is not enough if the service provided still falls below the standard of care. The best practice, and what strong brokers enforce, is a two-step approach: disclose the limitation and bring in a qualified professional. This ensures that the client is fully protected and reduces liability exposure. How standards of care are established. The standard of care is not created by a single law. It is developed through a combination of statutes, administrative rules, ADRI guidance, broker policies, industry practices, and court decisions. For example, the use of AAR contracts, SPDS disclosures, and standard transaction procedures have all become part of the expected level of service in Arizona. Even if not explicitly required by statute, these practices can still be used to determine whether an agent met the standard of care. Case law. How courts define liability. Court decisions play a major role in shaping the standard of care. For example, in Aranki v. RKP Investments, the court held that agents are not required to discover latent defects. However, cases like Easton v. Strasburger influence the widespread use of disclosure practices such as the SPDS. These cases demonstrate that standards evolve over time, and brokers must stay informed to ensure compliance. The anatomy of a lawsuit, how things go wrong. Most real estate lawsuits follow a similar pattern. It begins with a breakdown in communication or failure to disclose a material fact. This leads to a complaint, which may escalate into an investigation or civil litigation. From there, attorneys and expert witnesses evaluate whether the agent met the standard of care. If the answer is no, liability is established. This reinforces a critical concept. Lawsuits are rarely about intent. They are about whether the standard was met. Real-world example, a breakdown in care. Consider an agent who advises a client on a commercial property without experience in that sector. Even if the agent discloses their lack of expertise, failing to bring in a qualified professional could result in financial harm to the client. If a lawsuit follows, the question will not be whether the agent tried. It will be whether the agent acted as a reasonably prudent professional. This is where supervision becomes critical. Brokers must prevent agents from operating outside their competence. Broker responsibility, setting the standard. The broker plays a key role in establishing and enforcing the standard of care within the brokerage. This includes training, policy manuals, transaction review, and ongoing supervision. If a brokerage consistently operates below the standard of care, it creates a culture of risk that can lead to repeated violations and legal exposure. How this section connects. Forward. This section is the bridge between compliance and risk management. Everything we have discussed, licensing, supervision, compensation, and legal scenarios, ultimately feeds into whether the standard of care is met. As we move forward, we will continue building on this concept by focusing on risk prevention strategies and how brokers can create systems that protect both the client and the business. The takeaway is clear: meeting the standard of care is not optional. It is the foundation of survival in real estate. Online discussion, question 1. What is the standard of care in real estate? Answer: it is the level of skill, care, and diligence that a reasonably prudent real estate professional would exercise under similar circumstances. Question 2. Why is the standard of care important in lawsuits? Answer: because liability is determined based on whether the agent met the expected professional standard, not their intent. Question 3. How can a broker reduce standard of care violations? Answer: by implementing strong supervision, training, and policies that ensure agents operate within their level of competence.